Most of us have probably not thought too much of COVID-19 recently. Of course, this issue is not nearly what it was 3 years ago, even 2 years ago. But chances are, if COVID-19 does rear its ugly head for you after next Thursday, there's a good chance it's going to cost you some money. And that is what mainly the national emergency ending will mean for you. It means local health departments will no longer be able to offer free services when it comes to COVID-19, such as testing or vaccines. Treatments will also come at a cost, or all will become part of a normal health issue the insurance could cover. Now, back in February, we spoke with Dr. Stephen Stack about what the May 11th date would mean for Kentuckians.
The bigger issue may be for people who want to access treatment where it won't be purchased by the federal government, most likely going forward. People have to use their private or public health insurance in order to help pay for those medications.
Kentucky did have a state emergency that was issued by Governor Beshear in March of 2020. That actually ended last year by action of the Kentucky General Assembly. Dr. Stephen Stack also stated that one thing that he was concerned about was about 240,000 Kentuckians enrolled in Medicaid getting some services, as that will have to now shift to some other programs. Phil Pendleton, WKYT.